I'm Madison Niceley, Customer Marketing Manager here at Bloomfire. We're thrilled to be joined today by HaoWei of Oak Street Health, a visionary leader in healthcare operations with over 15 years of experience spanning the US and abroad, and also by my colleague Betsy Anderson, Bloomfire's Director of Customer Success, who will help guide our conversation today. In this session, you'll hear how HaoWei and his team built a centralized knowledge hub that transformed the way cross-functional teams align, collaborate, and execute with confidence. If you've ever felt the frustration of chasing down scattered information, onboarding in or making decisions without a clear, trusted source, you're not alone. Oak Street Health Story is packed with wins and practical strategies that can help you apply to your own, that you can apply to your own organization. HaoWei, let's start with what brought you and your team to Bloomfire. Can you walk us through why you decided to partner with us? What were some of your expectations for how the platform would be leveraged, what it would solve, and what type of outcomes, whether that be various KPIs or ROI metrics, you and your team were prioritizing from day one?
Yeah, sure. And first off, greetings from Dallas, Texas. I'm happy to be here. I would say, right from the start, we saw Bloomfire as a way to connect our growing teams with the information that they needed without having to constantly dig or second guess, which in our line of business, dealing with patient outcomes in a value-based care setting, we just really can't afford that. And so in my opinion, I think what really stood out from that very beginning and drew us to Bloomfire was the search, right? The power behind the search and the intuitive interface, which we've been able to tailor to both our clinical and non-clinical users. Also, the level of support. We really wanted to create a human-centered approach with this new knowledge management system. And during implementation, it required us to go very intently and a little slow at times, but also very quickly at different points too. And Bloomfire was there with us the whole way. At the end of the day, we really wanted this new tool to be embedded fully in our culture here. We even named it the trunk to represent our tree theme at Oak Street Health and just to represent our knowledge trunk as a whole. It actually started off as a pretty fun moniker, almost like a joke, and it really stuck with our earliest pilot teams. So, that ultimate goal, we wanted this knowledge management system, the trunk, to be more than just a tool. We wanted it to be a reason people not only would come and work at Oak Street Health, but also stay with us. And we needed a partner that could help make that a reality, and that's what Bloomfire was. And then regarding the metrics, I would say teammate engagement was one of our biggest ones. We also looked at frequency and effectiveness of search and time saved across roles with real-time studies. But ultimately, the impact on Net Promoter Score was really important. We wanted to not only reduce noise, but also increase employee and customers' confidence and satisfaction in the product.
And then, Betsy, you talk to teams across a wide range of industries. Do you see similar motivators beyond the healthcare industry that you could speak to?
Yeah, absolutely. And hi, everyone. Glad to be here today. HaoWei is in the Dallas area. I'm in Lubbock, Texas, which is the sadder Dallas, but still glad to be here. So what HaoWei was just describing, we hear all the time. It's this idea of needing to make your knowledge more than just storing knowledge. We hear this across financial services, professional services, logistics, organizations that run the gamut. And what I've found is the standout organizations are doing exactly what HaoWei's team is doing. And they're the ones who are not just storing knowledge, but they're activating it and then integrating it into their culture. They're thinking beyond things like folders and files, and they're really asking themselves, how do we help make this part of the employee experience? And when companies frame their knowledge base kind of like a product, one that's intuitive, well-governed, and really valuable, they see real returns. They see faster onboarding, they see better decision making, and even better talent retention. So our goal is to always make information accessible and actionable through one centralized platform rather than just available. And it's not just about having more information, it's about making the right information easier to find, to trust, and to use.
And HaoWei, you mentioned that you and your team implemented Bloomfire with the main goal of creating a trusted go-to knowledge platform that cross-functional departments could be leveraging in their day-to-day. I'd love to discuss what that unlocked once it was in place and fully launched for the team's use, specifically in terms of collaboration for you all. And then before Bloomfire, how were teammates trying to share and find information across departments or locations, and what kind of friction were they running into when they were looking for that as well?
Yeah, so I would say before Bloomfire, and even when I first joined Oak Street Health in 2022, we were really scrappy. We didn't really use Microsoft Office or the Office suite. We relied on Google Chat, Google Links, and scattered shared drives. That was very, allowed us to be very nimble and fast, but over time, as we've grown so much in the last few years, it's made it really hard to track and trust, right? It became inefficient, and it also created barriers across teams. We had teammates that were unsure who owned certain documents. They didn't know if it was up to date. Maybe it hadn't been updated in a while. Who is responsible for updating it, or whether it was just a draft that still needed review. I just, speaking from my own experience when I first joined, I was looking for some teammate benefits and found some conflicting documents. Turns out I found something that was a little outdated. And so all of that, I think, just discouraged sharing and collaboration amongst the teams. But really, it concealed the amount of knowledge that we had in our organization and amongst our employees. We wanted them to feel empowered to know where to look, who to ask, and what was that single source of truth for them to come to so that they could find that knowledge that they were seeking in a very timely manner. Just the former ways of how we were using, Google Chat, Google Links, all the shared drives, it was really starting to slow us down from where we wanted to be as an organization.
And now that you and the team have Bloomfire, or the trunk as you guys call it, what's really changed in terms of how your teams interact with one another?
Yeah, I think it's changed in several big ways. In general, it's been a huge cultural shift, right? It's changed not only how we find content, but really also how we create knowledge and how we create content. Since then, we've built new knowledge boards, big fan of that functionality, resource pages, series, bookmarks, everything from frontline playbooks for clinicians to department level best practices. I'll say that it's even changed how we train and onboard folks, but also how well teams are now being, how well they're being known across the organization. To give you an example, some of our biggest users reside in our call centers. And prior to that, because everything they do is behind the scenes, a lot of our frontline teammates didn't really know much about our call centers, how big of scope they took on and exactly what they were involved in. But they've utilized the trunk and Bloomfire to use it as a platform to share with everyone else across the organization all the work they're doing. And that's helped create better collaboration and connections across the entire organization. And I would say outside of content and creating those connections, the trunk has really become part of our language now. We've even taken this opportunity to curate our knowledge better, add in better governance around the trunk so that we can really create a subculture around knowledge management. Say the trunk has almost become a culture within our broader Oak Street Health culture. In fact, during our CVS transition, one of the first things they said was the trunk won't be impacted by this migration. And so seeing the reaction from our teammates, even, strangers, right? These are teammates that I don't know personally, but they are using our platform every single day. Seeing their response to that news was huge validation into all of our efforts. I think it really just showed how deeply and quickly the trunk had become embedded into our fabric.
Yeah, I love that. That's so powerful. And while internal collaboration is significant, have you observed any external ripple effects, such as with patients or service delivery, that you can also share with our audience today?
Yeah, so I think, I'll caution around saying that the trunk is directly tied to patient outcomes, but what I do know is that it's giving time back to our frontline teams. And that's something that we've been able to track with our time studies. And it's allowing our teammates to find what they need faster, but not only faster, also more accurately. So, for example, before Bloomfire, when we did those time studies, we actually asked our frontline teammates to find some of these pretty critical clinical documents, and we timed them and saw exactly how long it took for them to do it, what was their approach, and did they find the right document. And before Bloomfire, it took on average 3 search attempts and nearly 2 minutes to find the right answer. And even then, the accuracy was below 50%. And so when you think about clinical guidelines, that's something that's quite concerning. But in today's world, one search, 25 seconds or so, and close to 100% accuracy in our time studies. Not only that, our internal net promoter score went from -62 to a +54. So when you think about it, that's a 116-point swing, which is just tremendous. And it lets us know that people are not only using the platform and trusting it, but they're also enjoying the process. Since implementation, we've heard quotes like, "The trunk is my favorite tool at Oak Health," or "What would I do without the trunk?" And these are coming from individuals that range from call center teammates all the way to senior medical directors and other frontline staff. And I think it's doing what we really wanted to do the most, right? Which is give time back to those individuals so that they can do what they do best, which is taking care of our patients and rebuilding healthcare as it should be.
I love this so much. HaoWei, your story really highlights a pretty common trend that I've found across industries, including healthcare, finance, manufacturing, which is the more distributed the teams are, the more essential shared knowledge becomes. So it's not just about storing things in one place, which has historically been how we've always talked about it, but it's about that trust piece. It's about eliminating that second guessing. So when knowledge is centralized and governed and trusted, you don't just get better collaboration, you're able to unlock almost this multiplier effect where you get faster decisions, stronger onboarding, and higher confidence across every role. And what's especially impressive to me about Oak Street Health is how you guys made knowledge sharing a true cultural practice. It's really, that piece is where this becomes a transformational process and tool. It's not just a tool, it's how people work, it's how people connect, and how they contribute to the organization. Very, very cool.
Exactly. And it's very clear how the trunk isn't just a repository. It's truly a backbone of the business across all different teams and departments. Next, we'll look at how that backbone scales to support even more growth without increasing complexity. So what you've described so far, HaoWei, is this really thoughtful transformation from scattered knowledge to a trusted central hub. But as we all know, maintaining that clarity while growing quickly is where many systems break down. Can you speak to how your team sustainably scaled the Bloomfire platform efficiently and effectively while also maintaining that operational continuity? And how has Bloomfire supported Oak Street Health through that?
Yeah, great question. So I would say first off, when we started, it really did feel like a blank canvas, and all of that flexibility gave us this really great opportunity to design it the way we wanted. Earlier I mentioned how we wanted to utilize a human-centered design approach, and that's exactly what we did. And Bloomfire was there to provide support and guidance through all of that. All the flexibility with features like, what kind of access tiers do you want? Do you want to use groups? Do you want to make the look and feel of the landing page look this way or that way? And all the simplicity of designing around real user needs made it the right fit for our fast scaling environment. And when I mentioned those design sessions and that human-centered design approach, we took leadership all the way down to frontline end users and put them through several sessions led by our product teams. And that helped us answer all those questions around the features, even to the level of what kind of knowledge or content or use cases we want to have in there. We even had time to build out the culture around the trunk. That's how we got the name the trunk, right, for our platform. It's how we also came up with terms like foresters for our super users, and how we were able to create contributor models and trainings for authors and users, and what exactly that would look and feel like to make it more familiar, but also to really take advantage of everything that Bloomfire could do and offer us. And I think overall, the thing that I appreciated the most is that Bloomfire, they were able to offer guidance and insight without helping direct us too far in one direction or the other. They really empowered our team to have full ownership to make those decisions, and they were there to provide guidance along the way.
Yeah, so fellow Okies helped shape how the platform looks and functions, which I'm so glad to hear that you guys really pulled in your end users as far as when you were setting up the platform, because what we found is when our teams do that, that's where they get the most, the highest adoption and engagement in their platform. So not a surprise, but very happy that you guys ended up doing that as well. Also, how would you say that translated from into day-to-day impact and engagement across the board? If you could speak to that a little bit more, HaoWei.
Yeah, sure. So coming out of the design sessions, even early in pilot, we did see Bloomfire and the trunk as a one-size-fits-all. And I think we quickly learned that we needed to adapt the way each team actually uses this platform. And so, for instance, we found out that our call centers, they're constantly on the phone with our patients. They wanted everything in one single place, streamlined and easily accessible. So search links, really robust resource pages, having all that information grouped together for them, properly categorized and tagged, that was really important. Our clinicians, on the other hand, they prefer content grouped by initiative, right? So by workflow, by different, buckets of information, but also we needed to group their information by geography, because some of the guidelines and state standing orders would mean that a clinician in Michigan would have different knowledge that they would need to follow versus maybe a clinician in Texas. And so being able to do that really allowed us to tailor the information and the knowledge to all the different cohorts and their needs. And then finally, I'll say that the boards functionality and resource pages, that let us tailor by cohort and by function. And even this year, our big push is now reorganizing some of that content to be organized by workflow. And what I mean by workflow, I'm talking like an initiative that's rolling out, something that maybe isn't just handled by one teammate, but is handled by several teammates in that workflow. So perhaps it's a physician, it's also a medical assistant, a nurse, maybe even someone that's working the front desk, checking patients in. Every person involved in that care path can now find what they need in one spot. And that's been a big push for us this year.
Yeah, that's such an important distinction, I feel like, designing around workflows versus titles. So have you also seen the platform evolve in terms of use case, and just speak to the overall flexibility and agility of the platform as a whole?
Yeah, in our design sessions early on, we thought we captured all the use cases, but I'll be honest, the platform was purposely not designed for every use case, because over time we've learned a lot. And I think that's been really part of the success. We found out that because of PHI and HR content sensitivity, we've decided to keep that material in, separate systems. But I think what's great is if any of our use cases shift down the line, Bloomfire can work with us to accommodate those shifts. It's so easy to make these tweaks. It's almost, you have to control yourself from making too many, because you don't want to introduce too much change for the teams. But speaking of change, I would say one of the newer ways we're using Bloomfire and the trunk is to help support all the change management. With so much movement in our organization, being able to keep our knowledge pantry clean and current is critical. And all the analytics and underlying data and reporting tools that we're given visibility to, that's really helped us understand where we can be better and where we can focus our attention on. And then in terms of some other KPIs, we haven't really specifically tracked onboarding KPIs, but the trunk is introduced to every new cohort during onboarding. And for some roles like scribes, medical assistants, and nurses, where industry turnover is a little bit higher than normal, it's been described as something that makes work easier. And I think in a fast moving clinical environment, that's worth its weight in gold.
It's really inspiring to hear how intentional you and the team have been, not just at the beginning, but throughout this entirety of this partnership, as far as scaling with structure and not just adding complexity too. But your story aligns closely with what we've actually seen across more than 100 organizations in our Value of Enterprise Intelligence report. On average, companies using Bloomfire reclaim nearly $2.7 million in productivity savings per 100 employees per year, just by reducing that duplicated effort, improving search accuracy, and also accelerating their strategic decision making. When we hear what the trunk has delivered, from search attempts dropping from 3 to 1 to a 116-point NPS swing, it's a real world example just of what that value in action looks like. Betsy, what resonates most here from what you've seen across the different organizations and industries that you work with, going through those similar growth and transformations?
So much of what HaoWei has shared mirrors what I hear every day from other fast-moving organizations. And frankly, all organizations are being asked to be fast-moving to keep up with the economic changes and the world changes. So what they're really looking for is not just a place to share knowledge, but a system that can really adapt as their organization adapts, as the country adapts, and scalability in knowledge management so often is thought of as just numbers. So number of users, number of resources, documents, but it's really about being able to meet different teams where they are without losing that cohesion. So whether it's a clinical team like HaoWei's, where they have 5 different states and they're trying to keep everyone aligned and looking at the appropriate information, or it's a support organization with 500 reps, Bloomfire's structure provides you the guardrails you need as well as the freedom. So you're able to balance that governance with agility. And honestly, when organizations like Oak Street Health start designing knowledge based on workflow, not just function, that's when you really start to unlock that cross-role clarity, which helps with the faster decision-making and the reduced operational lift. That's where Bloomfire really shines, and why scalability has to mean more than just size. It has to be about fit, flexibility, and ultimately future-proofing, right?
So well said, Betsy. It's really clear that fit, if you will, has been that guiding principle over at Oak Street Health. Well, we've covered a lot of ground today, from why Oak Street Health partnered with Bloomfire to how you've used it to break down silos across your team and organization as a whole, scale effectively, and give time back to those teams delivering that critical care. I want to drive this home a bit with one big takeaway. This isn't just about centralizing content, it's about transforming how people work together. So HaoWei, when you think about that broader impact the trunk has had at Oak Street Health, not just in your department, but across the organization, what would you say stands out to you the most?
So I think I'll first start by saying that if there's one thing that's a constant in our world, it's change, right? And whether it's CMS guidelines changing, state standing orders changing, one workflow retiring, a new initiative or a new workflow coming in, that's the one constant in our world, is change. And I think the trunk throughout all of this has been our knowledge North Star, and it's been an anchor amidst all of that change. And so what that does is it really helps create clarity and consistency without slowing us down. Actually, it makes us faster. And it also makes everything very simple, right? If you come across different versions of something, the one in the trunk or in Bloomfire, that's the right one. That's the one you should refer to. And if something isn't there, then that's the one place we need to put it in first. So everything just becomes more simple. And because of that, we're spending less time digging through folders, double checking whether content is accurate or up to date, or waiting for that one right person to reply to a message or to update the content. And I think the beauty of Bloomfire and the trunk is that we didn't really reinvent the way people worked. We just made it easier for them to access the right knowledge to help them work smarter. The content was always there for them, but now they can have it at their fingertips when they really need it. And so when I hear teammates tell others like, oh, you should go to the trunk to find that, or, go find it, go search for it in the trunk, or, hey, here's something that I found in the trunk that I think would be helpful, and seeing them, not only utilize a platform, but engage in it, share with others, that lets me know that it's sticking and it's working, and that we're not just sharing information faster. I think we're actually increasing the overall knowledge level across all of Oak Street Health. And I think that's super exciting. That's what really stands out the most.
That's such a great point. And just for those of you watching, whether you're in healthcare, insurance, finance, education, something completely different, the common thread here is knowledge is either accelerating your business or quietly slowing it down. It's either helping you or hurting you, period. There's no in between. And often the difference is whether people can find and trust the information they need in the moment they need it most. If they can, you're solid. If they can't, you're in trouble. And we often say that your most under-leveraged asset is cross-functional clarity. And today's conversation, I think, proves that beautifully. When you unify your knowledge into a single governed, accessible platform, you're unlocking those ripple effects that I've mentioned, I feel like, many times already today. Faster onboarding, smarter decisions, less rework across every team. And I'd encourage anyone listening to really think about the last time that somebody at your company had to just look around for an answer, or how long it took to onboard a new hire with confidence. The with confidence part is really critical there. That's where the opportunity lives. That's where we can really shine. And what Oak Street Health, I think, has done so beautifully is they've built out this living, breathing system for knowledge that adapts with them. It grows with them. And it's not out of reach for anyone here. It just takes really a clear starting point and having the right partner to walk through the journey with you. And for those of you who have already established a centralized knowledge base with us, this is a great opportunity to start thinking about ways that you can build on that success with more cross-functionally and with other teams and departments in your organization, because it just continues to build. The success breeds more success.
So well said, Betsy. Thank you again, both to HaoWei and Betsy, for sharing such great insight and real-world experience with us today. Truly invaluable. And thank you for all of you that have joined us today as well. If you'd like to revisit any part of this discussion or share it with even your colleagues and other team members, you'll receive the full webinar recording in your inbox shortly. And if today's discussion sparked any ideas for how your team could reduce complexity, align more confidently across departments, or simply make better use of what your organization already knows, we'd love to help you explore what that could look like. So thank you again for spending time with us, and we'll see you next time.
Thank you.